Welcome to the Triage Method podcast with me, Gary McGowan, and my co-hosts, Paddy and Dr. Nicola Flanagan this week. I haven't been on the podcast for a few weeks because I've just been, taking time off as always, really like DOSing. But it's good to be back. Hope my colleagues have been keeping you entertained, infotained, informed over the last few weeks. No doubt they have. And so what are we talking about today, Paddy?
Well, today we're talking about boob jobs. No, but seriously, we are actually talking about boob jobs today.
Yes, we
and
are.
potentially also mastectomies. Depends on how much we get covered in the first section of this. And this seems like something that you're like, why the fuck are you talking about boob jobs? But this is actually something that a lot of people in the health and fitness world experience, is that the right word? They go through, they get boob jobs, they get breast augmentation, as Gary says we should call it, but they get boob jobs. Okay. And there's not actually a lot of information out there. There's quite poor information out there in reality, and a lot of this is just women having to, I know this person that, got a breast augmentation when they were going for their bikini competition or whatever. So I'm going to ask them how they trained around it or whatever. It's a lot of word of mouth. There's no, here's an online resource of exactly what you should do. And then, as I say, with all these stuff, like I, scour the internet and I'm like, what are people exposed to? If I just typed in training, boob job, like what do I get? Right. And a lot of the information out there it's quite poor. It's never going to be personalized if it's just random information online, but it's not personalizable. It's just saying like, do this at week 6, do this, it's not very nuanced, so we want to cover a little bit about that. On the mastectomy side of things, that's obviously something that, hopefully not a lot of people have to experience, but it is something that some women are going to have to go through for a variety of reasons, and we'll go through that as well. So we have to know how does that impact on training, So we're basically covering today some sort of surgery to do with the breasts and then training around that. There probably are some implications for diet and, lifestyle and whatever else, but we're not going to focus too much on that today. We're going to focus purely on the training side of things along with, the surgeries and stuff. So who wants to field the question? What's a boob job?
You can lead the way, Nicola.
So I suppose breast augmentation, there's many reasons why women might get one, but like you're saying, it's particularly a lot of women in the fitness industry, particularly bodybuilders, might get a breast augmentation. And so the breasts are made up of a couple of different tissues, but they're mostly fat, but you also have kind of glandular tissue in there, and you have some connective tissue as well, but they are mostly made up of fatty tissue. So that's why particularly when women are dieting, and particularly in bodybuilding, when they get down to a really low body fat percentage, like we do see, that reduce, obviously. And then what a lot of women find then is that when they start gaining weight is that they might not, it might not go back onto their breasts. And obviously it's a highly personal thing, but a lot of women might get it when they're competing, just to feel, I suppose, a little bit more feminine, but obviously it's something that's not necessary for when you're competing. It's just like a completely personal choice that a lot of women, that some women, I suppose, get. But there's a few different types of breast augmentation you can get, which will obviously be down to kind of you and your surgeon, what kind of desired kind of look you're going for. But typically you can get implants either kind of over the muscle, or you can get it underneath the muscle. And there's a couple of differences between that. So over the muscle, there'll kind of be a shorter kind of recovery time for that. Under the muscle, they cut through kind of your pec major. It gives kind of more of a natural appearance, and then over time the implant kind of sits into the breasts a little bit more. But because you are cutting through that muscle, it is a longer recovery time for that. Another thing about that as well, if you are going under the muscle, particularly if you're someone, like a power lifter, kind of doing a lot of kind of chest exercises, when you go under the muscle, the implants kind of can move out when you're contracting the pecs. So again, over time, if you're doing kind of, you know, a lot of volume, a lot of chest exercises, it can kind of lead to this kind of what we call like an animation deformity, where the implants actually kind of move out to the side.
Gary, anything to say on that?
No, not on that specifically. That's cool.
Yeah. One of the other things about like over, under, you know, depending on which one you get, if you already go into this with a lot of muscle, that does actually kind of change things a little bit. Like, say, for example, you're someone that's been training for, I don't know, whatever, let's say just 10 years. Again, let's say you're a power lifter, you've been doing a lot of bench press as well. So your chest is relatively well developed. Like, that is going to be different than someone going in and they have very little chest muscle, you know, going into the surgery. First of all, like, that's going to impact on, you know, recovery times, etc. But it's also going to impact on like a whole host of things downstream of that, you know. So even though we're talking about, you know, oh, it's just like over or under or whatever, like it really does depend on the individual, what they have going on in their life. And that's obviously then going to impact on what our, or well, not our recommendations, but what the recommendations are for them as someone that's trying to train around this, you know. In my experience, I've trained a few like bikini girls, a few like people that are, you know, have had breast augmentations and stuff. Like, a lot of people often choose under the muscle purely because it looks like quote unquote more natural. But I have seen a few people choose over the muscle purely based on the fact that the recovery time is shorter and they want to get back to training quicker, you know? And like, that's obviously a personal choice, but I think it's a little bit short-sighted in terms of, yeah, okay, you're going to have to wait a couple of weeks for recovery. But if you get a better result in terms of what you're actually looking for overall, in terms of the look and all that kind of stuff, like, you're probably better off going for under the muscle in most cases. But this is something that you have to obviously talk with your surgeon with, you have to talk to your doctor. Like, there could be a whole host of confounding factors why you have to go for over the muscle versus under the muscle, whatever. But it is something to consider from the outset. You know, it's like, what are you actually looking for? And this is, again, this is one of the areas where, you know, it probably is best to also talk to other people who have had breast augmentation, in terms of, you might go, oh, this person has a really nice look, that's exactly what I want to get. What did they do? You know, versus just going into your surgeon, going into whatever medical clinic or whatever that just do boob jobs and that's what they sell. You know, they're obviously going to try to sell you what they want to do versus what you actually want to get. Now, obviously, there's that interplay. That's the same with any business. But if you know, oh, I actually really prefer the over the muscle look, or I really prefer the under the muscle look, or I really prefer XYZ, whatever, it depends, you know. That is something that you should go into the consultation or whatever knowing a little bit more about, you know. So either of you, do you have anything to say on just a general boob job in general?
I suppose just one thing is to note that because this does come up in some health cases, that, you know, there are different types of implants that you can receive, in terms of whether they're saline or silicone or a combination of both. So that technology has obviously changed over the years. But one of the concerns that comes up time and time again is in relation to breastfeeding. So and that's obviously relevant to the podcast we've had previously in relation to pregnancy. You know, women might think, am I going to have poorer milk production? Am I not going to be able to breastfeed? Am I going to pass on silicone to the baby? And this has been pretty well, you know, studied. It doesn't seem like there's much of a difference in terms of the rates of women that end up going on to have successful breastfeeding between those who've had an augmentation versus not. And when you compare normal breast milk levels of silicone to those with, you know, silicone implants, which might be of concern, there doesn't seem to be a significant difference there either. So I know that's one area of concern. And I suppose the other one then is that in relation to the health side of things would be breast cancer is a question that comes up. And two kind of levels to this. One, is there an increase in risk of the development of breast cancer, maybe because of the procedure itself or what you're putting into the breast? And it doesn't seem like that's the case from like my understanding of the evidence. But it's kind of to some degree, it's a difficult question, because the rates at which like any type of cancer are diagnosed are heavily dependent on the point at which screening takes place, and obviously what you're identifying on screening. And in order for someone to effectively, diagnose breast cancer, they need to be able to, let's say, identify or palpate a lump, for example, or mammography needs to demonstrate a particular sign. And there just can be some additional challenges for someone, maybe if they're not familiar with breast augmentation, how that changes imaging and those types of things. So there is the potential that might, make it a bit more complicated. But I think, if you're in a well-developed country, you're going to have people who are fairly experienced with that. You're probably going to receive some guidelines on what a breast augmentation might mean for you in terms of differences in identification. But overall, it doesn't seem like it's a massive concern unless there's rare complications.
And also you could argue that, like, if you're going out and getting a breast augmentation, you would be getting more screening than someone who, maybe they're waiting until they're fucking 30 odd to get their initial fucking mammogram or whatever, so like you could argue that you might pick up cancers earlier if you are getting breast augmentation. But again, like, that's just an aside. There is another thing as well, that just on the topic of like boob jobs in general, like you will see online a lot of people say that they got some sort of, I don't know what the word, you probably call it some sort of autoimmune or immune reaction to the breast augmentation. Like you'll see a lot of people, put it out there that, oh, I got rid of my, breast augmentation, my boob job, after 5-10 years because I was getting all these different symptoms. And that does seem to be the case for some people. And it's kind of poorly understood, at least from my understanding in the research, because there isn't like, oh, and like an identifiable, like, this is exactly what happened. Like, for example, if you had some sort of a very small hole or whatever in the implant, and you're like, oh, it was actually slowly leaking out silicone or saline or whatever, into the blood system, you could be like, oh, we have an identifiable thing. It was actually just a little bit of a mistake or whatever, an error. So that was actually the issue. It's not the actual like boob job itself, But I don't think we have very clear evidence for that. Obviously, that happens in some cases. So, like, obviously, but it seems to be that some individuals just get some sort of like generalized inflammatory response to having something else in their body, So it's a bit of a weird one, but that is something that you will see some people say. So, it is something to discuss with the doctor, to discuss with, people that are looking after you in general. Like, even just asking the question of like, what happens if in 5 years time I'm, sick as a result of this? What's the protocol? Like, does the place that you're going to get this done, do they have a, 5-year checkup, a 10-year checkup or whatever? Like, what's their process? Are they just going to leave you completely high and dry? Like, a lot of places will have like, oh, if you're not happy with this after like, 6 months or a year or whatever it is in the specific place, they'll be like, we have processes in place for like what the next step is. Like, obviously ask about that. Like, if you're not happy about it, like, obviously, but you should also be asking like, what happens if I start getting like some sort of health effects from this down the line, but I do think some people kind of pathologize it in terms of they're looking for something, they're getting some sort of nondescript inflammatory immune response, and they're like, oh, could be the boob job, so it's kind of hard to say. Do either of you any thoughts on that?
I suppose just with that said, like, I mean, regardless of the type of procedure, I think everyone that considers any surgical procedure should consider surgery to be a serious intervention, because anytime you're breaking the skin, anytime you're going in, and same with my hamstring, that was a serious intervention. It's like, oh, it's just a sports surgery, you're just attaching tendon to bone. But anytime you break the skin, anytime you go in there poking around, like, you have to realize that the ability to do that safely is so incredibly new. Like, that's totally new to us. And complication rates for any surgery are never going to be 0%. So when you consider procedures like this, there's always going to be a risk of, delayed healing or post-op infection or bleeding, the development of little pockets or swellings of pus, all these types of things.
Even like people that fucking do it all the time, anesthetics, like,
yeah,
so many complications,
anesthetics, 100%. So you should always view this as a a serious intervention. You know, sometimes people think that, oh, it's a cosmetic procedure, it's not as serious. It always is. Whether you're sick or not, surgery should always be considered to be something that you weigh up the pros and cons. And obviously, in many cases, when people are sick, it's necessary. You know, you have to get a surgery done. In the absence of that, it might be something that, you know, you pay more attention to the pros and the cons. Do I really want to do this? Do I understand the risks, etc.? I think that leaves you in a better position. Firstly, for providing informed consent, but long term, if complications do arise, you're like, well, you know what? I did see this coming. I knew this was a potential event that could happen. Because sometimes if people haven't been adequately informed, or maybe they haven't done their own research, they don't understand, then they get complications and they're just totally blindsided, and they, you know, feel like an idiot. You see this a lot with the turkey teeth situation at the moment. You know, everyone going away to get their turkey teeth, and all you see is these pros and cons on TikTok and this type of thing, and everyone's delighted. And then there are a few horror stories that pop up, and then they're like, I didn't think this was possible. So yeah, you have to be aware. If you're letting someone break the skin, cut into your body, you need to know what you're doing.
You're telling me that filing my teeth down into spikes, there's no cons with that?
I know, who would have thought it? Seriously.
Anyway, so we talked about, you know, breast augmentation in general. We could obviously have a huge discussion about this, all the nuances, but that's not what this episode is about. Training, right? So you've had your boob job. Over, under, you know, it doesn't really matter what's going on here. How does it impact on training? Nicola, do you want to jump in so Gary doesn't jump in again?
So this will look different, you know, like between women. Like some women, like Gary said, will experience, you know, a lot of complications. Some women might have more pain than another. There might be, you know, reduced kind of like wound healing in one woman compared to another. So it really is kind of, you know, dependent. I suppose one of the biggest things, you know, if you're a competitor, whether that's kind of like bodybuilding, powerlifting, you know, running, whatever it is, you know, you are looking at a certain amount of weeks, if not months, for you to have a, you know, a complete kind of return to previous activity. So it is, even just from a scheduling perspective, you want to make sure that you're kind of leaving enough time between kind of training and like competing. But we're looking at kind of like a slow return to exercise. You really want to avoid anything that's going to aggravate kind of, you know, the chest muscles, get your heart rate up too much, particularly in that initial period. So even in the first week, you know, you're looking at just kind of walking, essentially kind of light walking. And then after that, you know, kind of about 2 to 3 weeks, they generally recommend kind of, you know, light cardio, lower body cardio. So like the bike, whether that's kind of on the stepper, but kind of at a low intensity, and, you know, not really having any kind of, you know, kind of pulling movements in the upper body that will kind of aggravate the chest muscles at all. It's really about taking it kind of like 1 week at a time and kind of building up that exercise tolerance. So, you know, you're not going straight from, you know, kind of, you know, 5 minutes on the stepper to kind of 40 minutes, you know, by the end of the week. It is really like you have had a big surgery. So it is about that kind of just slowly kind of building up kind of exercise tolerance. And then at about kind of 4 to 6 weeks, you know, you are kind of, a lot of women will find that they are able to kind of do kind of maybe a light jog, you know, provided they're wearing proper kind of, you know, like sports bra or compressive bra still. And then like building up kind of lower body exercises as well, strength exercises, you know, can be appropriate during this time. And then in terms of upper body, again, you're really just looking at kind of, you know, kind of light stretching in the upper body. And again, no kind of like, you know, kind of like, you know, push-ups, kind of pull-ups, even things like planks, you know, can be just kind of too much tension on the chest.
Yeah, and this is something that actually people forget all the time, is that, well, first of all, especially if we've had this under the muscle, like as we said earlier on, like you're basically cutting through the pec, right?
Yeah.
You basically can't use your arms then. You know, like people will forget this, and this is really important to understand. If you are like, I don't think you get time off work. I think it's supposed to be like a day procedure for breast augmentation. So like, it's not like you can go, oh, I've had major surgery, I need like 2 weeks off work or whatever, you know, the way like the fucking whatever system treats it, it's like, oh, this is day surgery, you know, but you basically are not going to be able to use your arms, you know, at least for the first, you know, couple of days, maybe up to a week. And people forget that. It's actually really important because, you use your arms for quite a lot. Like, think about this in terms of like, oh, you're lying down in bed. Try to get out of your bed without using your arms, and it's both arms because, presumably you didn't get just one boob done, you got both done, right? So try to get out of bed without using your arms. Like, yeah, you can roll out, but you're still probably using your arms, your shoulders and stuff like that. You're not going to be able to do that, at least for the first couple of days. So you have to account for that. Don't be just thinking like, oh, well, I'm going to be different. I'm just built different. I'm going to be back in the gym in like, a couple of days. It's not going to happen. You're going to need to take some time off. You're probably going to need to take some time off from life in general. You're going to need to recover, like it's a surgery, and then after that, like you mentioned, it is that slow return to exercise. They do generally say, oh, it's that kind of 4 to 6 week mark where you can kind of start getting into some lighter exercise, some lighter upper body movements. But even then, like as an individual, it could be 10 weeks for you. So you can't just take it as, oh, I'm going to be in here 4 weeks time, I'm going to be back in the gym doing whatever. For another individual, might happen. For you, that just might not be the case. And again, it's hard to tell exactly what the determining factors are in this, because again, you could be someone that already has quite a lot of muscle, and you might be thinking like, oh, like I'm going to be back in the gym so easy. But that means that you have to cut through that muscle. So you've probably got more recovery to actually do than someone that has, less muscle, because they also probably weren't using that much muscle doing different exercises in general. So there's so many confounding factors in this that it's impossible to give you an exact timeline, but we are generally looking at that kind of 4 to 6 week mark. Now, obviously, talk to your doctor, talk to your surgeon, etc. They're going to be able to give you a better timeline based on your circumstances. But once we do get into that kind of 4 to 6 week mark, that's probably when people start introducing a little bit more light upper body work, and even after that, because, bringing in light upper body work, it's fairly easy to understand, being like, okay, basically just let pain be your guide, see what's happening. Oh, you don't like that movement. Okay, lay off that movement. Don't be going into it. See what you can actually do. You might be able to do some, maybe some bicep curls or some tricep push. You might be able to do some very like light exercises, right? But you still have to listen to your body, right? But even beyond that 4 to 6 week mark, there can still be recovery. There definitely is still recovery, but there is going to be some sort of change in how you approach training, right? But before we get onto that, like the longer term stuff, it's probably a good idea to plan when you get the surgery, right? Like, and this is something that people kind of forget. Now, if you're like a bikini competitor or whatever, like it's a little bit easier. It's a little bit easier to go, oh, well, I want to compete next year, so I'm going to try to get my boob job as far away from that as possible, But just even for the general public, this is something that you should be considering. You should be considering like, when is the most optimal time for me to get this done, so that I'm not in an intense training period, or I'm not in an intense period of work stress. I can have some downtime. It makes sense to plan that out a little bit. So do either of you have anything to say on planning out, when we have the surgery? And if not, we can move on to how we would think about modifying exercise long term, or at least medium term.
No, I suppose, in terms of planning, like if you are having, a lot of complications, like your surgeon, your GP, whatever, doctor you're going to will support you through that, and can give you, like sick letters if post-op recovery is an issue. But yeah, like you were saying, it's kind of not to return too quickly, particularly if you've kind of more of an active job.
100%. Gary, do you have anything to say?
No, I think that's reasonable.
So how do we modify exercise long term? We're out of this 4 to 6 week mark. We started bringing in some light exercise. What do we do then? Is there any exercises, movements, whatever, that we should be avoiding or be careful about?
Yeah, so first, let me say something. This kind of encompasses the first 4 to 6 weeks, but also after. I think one of the things that you learn here that's kind of a vital lesson is the role of two different things. So one, the fact that when we talk about like pec exercises or pec movements in the gym, you learn a lot if you have a surgery like this, that, oh, these muscles are actually involved in a lot of different movements. It's absolutely not just the ones that we call chest exercises. And that's something that is often learned after surgery, or often learned in the presence of injury, because people assume that certain movements are going to be fine because it doesn't involve that movement. Like, you might be thinking, oh, well, my pecs are going to be affected because it's in that region, but my shoulders will be fine. I can do arm work, I can do rows, all those types of things. But realistically, probably not. And that brings in the second issue, which is the question, or the importance of skin and the amount of skin that one has. And well, I say this because in some cases, people consider cosmetic procedures for example, the spare skin around their knee. If they have too much skin and it looks ugly, I've heard of that recently, that people want to reduce the amount of skin. But you need an excess of skin there in order to permit full knee flexion. And it's a similar phenomenon here, where you might think, oh, well, reaching across my body is going to be hard because that's like the pec. But, if you're trying to put a seatbelt on, you have to stretch out all that skin. And if that has a surgical site and it's painful, that's going to be very difficult to do. And very similar when it comes to the gym. If you're doing like rowing type exercises, that might be difficult for a period of time, even just because that skin is tightened, that skin is, scarring, it's maybe a bit sensitive, etc. So do recognize that ahead of time, and then you'll be better set up. But when it comes to kind of reintroducing exercise, there are a couple of key considerations. Number one, with any chest exercise involving, for example, a barbell, you've now got a new end range of motion, potentially, depending on where you touch the bar on your chest, okay? So that does vary, of course. But, that might, change the path of motion of your movements. It also might be the case that now when you come down to a bottom position, there's just a different feeling at the end range of motion. And that might vary depending on whether you had the over or under procedure, for example. So you do have to play around with that for a period of time and kind of get used to maybe some differences in your normal technique that you mightn't have had previously. So that's kind of like the chest and the pressing type exercises. But the other one that's definitely really important is any sort of chest supported row variation or other chest supported exercise, prone exercises, etc. That's obviously going to be quite uncomfortable initially. And for example, if you've gone from a position of having small breasts to now having very large breasts because of the procedure, it now might be the case that those exercises actually aren't very appropriate for you anymore, because some women won't do chest supported exercises if it's applying a lot of pressure on the chest anyway, because it's just not particularly comfortable. So that can occur, and that might be something that you just need to modify more long term. But other than that, it really is, again, one of those kind of classic examples of what we would reintroduce after someone gets injured, where you need to figure out initially what feels good, what feels bad, what needs changing, and then gradually re-expose yourself. And what I would say is that after any procedure like this, if you've taken a few weeks off training and you're trying to get back to training, I think a good rule of thumb is give yourself at least the period of time that you were off. So for example, that first 6 weeks, to get back to the training you were at before you had the procedure. I think it's a decent rule of thumb where over that 6 weeks to follow, you start maybe at 30 to 50% of the volume or intensity you were previously doing, and gradually, as the weeks go on, build back up close to your normal training regime, while also being, reactive and responsive to any symptoms that you might be having. So I think that's the overall theme.
Yeah, and I think it is important as well in that time period to really take assessment of what range of motion that you have, what movements or exercises seem to be limited or that you don't enjoy as much now. Like obviously, like you said, like the chest supported exercises are an easy one in terms of you're like, okay, this feels different. Maybe there's an adjustment period. Like you've got, again, like new boobs, basically. You're like, oh, maybe it's just adjusting to this. Maybe it is a case that you're just like, no, this is just not for me anymore. Like maybe you're doing, I don't know, something like a seal row, a chest supported seal row. And you're like, there's just too much pressure here when we're talking about the bar pulling me down. I'm lying on this. You're just like, no, it's not an exercise for me anymore. I'm going to have to choose something different, right? So that's a little bit easy to understand. And obviously, training your chest, there's going to be some modification here, especially if we have had this under the muscle surgery. You're like, okay, my muscles on my chest have been operated on. There has to be some sort of change here. Like you've basically cut the muscles, so it's like, okay, you understand that, that's fairly intuitive. But like you were saying earlier on, Gary, there's some movements that you don't initially realize are, or that do utilize the chest quite a lot. And some of this is going to be, like you said, like the skin stuff, where you're just like your skin is stretched now because you've had surgery, you've got a scar, you've got, you know, boobs, bigger boobs now that you didn't have before. Like that all stretches the skin. But also some of it is going to be the actual muscle itself. For example, people don't often realize that, like, putting your arm overhead, it's like you're putting your pec in a little bit of a stretch, well, a lot of a stretched position here, you know, but that limits you in so many exercises now, in terms of like, okay, I want to train my shoulders, can't do it, you know, I want to do some, like, you know, lat pull down type movement, okay, can't do it, you know. So it's not going to be a case of, oh, I'm only going to have to modify, you know, chest related exercises and anything that I lie down on. No, you're probably going to have to modify some like overhead movements, some back movements, you know, anything that basically uses your arms, which is your entire upper body now. And also, you know, maybe even stuff that you usually train your legs, might be doing something like a, I don't know, a Bulgarian split squat, for example. And now even just holding those weights there, it's, you know, the pressive forces, you know, it's just different, and maybe it's painful for you. But also trying to get dumbbells off the rack, for example, or trying to put weights onto your squat rack, you know, you're just like, oh, I'm going to put the weights onto the bar on the squat. It's like your arms have to go overhead for this. You know, there's so many things that are affected that it might take a while. It might be, oh, I'm fully recovered in terms of there's no real pain at rest at 6 weeks, and I can start lightly exercising, but you might still notice that, oh, okay, I have limited range of motion, or I have weakness, we'll say, you know, it's just like, I used to be able to lift this much, and I used to be able to put the 20 kilo on the bar, because I know that's actually like a really hard exercise for a lot of women. You know, you're doing a squat and you're trying to put the 20 kilo onto the fucking actual bar itself, you know. So like stuff like that can be affected. So you're just going to have to take it a little bit slower. You're going to have to, you know, slowly get stronger again. And that unfortunately means that you're just going to have to be very patient with yourself, patient with your rate of recovery, and patient with, you know, slowly regaining the strength that you previously had. And then we have to also factor in that there may be differences in your overall range of motion. Let's say you get into this, you know, position where you're like, okay, I'm pretty much back to the strength that I previously had. Like Gary noted, you might have changes in the range of motion of like chest exercises, like we're doing a barbell bench press, but you also might have changes in the range of motion of like your pec's ability to stretch, for example. You know, you did have surgery through that. So it might just take much longer for that to get back to a position where you're like, okay, I can actually get like fully arms overhead or whatever. And you're just going to have to modify exercises to overcome that. You know, for example, maybe you can do some sort of like more incline dumbbell bench press rather than like a fully like shoulder press or something. You know, maybe for you, that's a little bit easier on stretching the pec, even though you're like, oh, well, that actually trains the pec. You know, you're just going to have to modify exercises based on what you present with, which can be hard if you are, you know, just the lay person. You're just like, okay, well, how do I change exercises? What exercises did I choose? I thought these were the best exercises, you know?
Check.
Definitely. Just making like few other things, you know, like we think of like yoga and Pilates as pretty like, you know, kind of gentle-ish exercises. But like you were saying, like overhead, even like downward dog, that's still kind of having your arms above your head, even though it's kind of in a different, you know, position. So just kind of being aware if you're, you know, after a few weeks trying to get back, you know, into those kind of classes, that they might actually be putting a little bit too much tension kind of on the chest. And things like tennis, golf, where you're using kind of a lot of like arm swing as well. You know, kind of just being aware, you know, before you kind of restart those kind of sports as well. Is a big thing. And another thing that a lot of women are concerned about with the over and under the muscle. So with the under, like you're saying, it cuts through the muscle. So wonder, you know, are they going to get kind of regain kind of full strength kind of, you know, in the pec, and most women do. So just to note that as well.
100%. And just on those like sports and different classes and stuff, like it probably is a better way to go about this if you use the gym more so as your kind of guide, like stuff that you can be fully in control of, you know. So you're just like, okay, I'm going to actually do something. Or even at home, like if you're like, if Pilates is your thing, rather than just going straight in, jumping into a class, just go, okay, I need to just, you know, do my own Pilates at home, see what I can do, what I can't do, modify the exercises accordingly. Same with yoga as well. Like there's going to be so many moves that you're just not going to be able to do initially. And rather than going to a class and kind of sitting there going like, I feel like shit, I can't do any of these. Like for half the class, you're like, I can't do this. Take some time at home to do it yourself, see what you're actually able to do. And then once you feel more comfortable that you're like, okay, I can do the majority of these poses, or I can do the majority of these movements myself, and okay, I might have to modify this, or I might have to do whatever, then maybe jump into a class. The only reason I say that is because a lot of people will feel like, oh, I have to go into the class and I have to follow along with the class. I have to do what the class is doing. And that might not be the best for your individual recovery, So is there anything else? Go on, Nicola.
Yeah, just if you're a trainer as well, just I suppose communicating, with your client, like you're saying, like there will be difference in kind of range of motion, but as well, just like the comfort of the exercises, like you were saying, maybe like a prone row. Also, a lot of women find like chest flies like really uncomfortable just from like a perspective that they can feel the implants kind of moving, and like the likely also have kind of not a new posture, but they might find themselves a little bit more kind of contracted forward. So really just about, like, a lot of women find kind of rows actually that they feel quite comfortable just kind of building back up kind of their back muscles, particularly like upper back kind of rows. So again, just communication is key.
100%. We do have in our notes here diet to help recovery, but I actually think we'll do a separate episode on that, because Gary, I think that would be a nice one as well with you, with your hamstring. We can talk about any interventions there because they're more generic. It's not like they're specific to breast augmentation. So we get stuck into mastectomy, unless either of you have anything to say to finish off the boob jobs.
Don't think so.
Fantastic. Mastectomy. What's the story here, Nicola?
So a mastectomy essentially is a surgery that removes all the tissue kind of within a breast. So if a woman has breast cancer and there's a lump found, it will remove all the breast tissue. And there's lots of different types of mastectomies that you can get, and I won't kind of go through each of them now. So you might have kind of one of your breasts removed, there might be two of the breasts removed, and again that'll depend on if a woman only has one, if they have one affected breast, two, or if they've one and they want to reduce the risk of recurrence in the second one as well. And then other women might have a mastectomy, like a bilateral mastectomy, like a double mastectomy, for risk reduction, even though they've not been diagnosed with breast cancer. So like famously, like Angelina Jolie had, like a double mastectomy to reduce her risk. So people might get that if there's, a strong family history of breast cancer or ovarian cancer, or if they've done genetic testing and have found kind of genetic mutations like the BRCA1, BRCA2. So they might have that done. So the surgery itself, like I said, there's lots of different variations, and it just depends how much is taken away, how much skin is spared, if there's kind of nipple sparing, or if there's reconstruction done. So you can have kind of reconstruction at the time of the mastectomy, or some people might have like a delayed reconstruction. So the reconstruction will either look like an implant, like we were just talking about. And again, there's lots of different kinds of the implants that you can get, or you can get like a flap, which is essentially where vasculature and kind of like fatty tissue will be taken from one part of the body and then basically implanted into the breast. So whether that's kind of like muscle tissue or just kind of like fatty tissue and vasculature, that's typically suited more towards kind of like smaller breasts. And again, it'll depend on kind of you and your surgeon and whether you're kind of getting radiation post-operatively as well. 100%. That's the nuts and bolts of it.
Gary, do you want to say that?
Yeah, I suppose just it is important to note that, like, if you've had a muscle reconstruction, so for example from your lats is a common one that can be used to reconstruct the breast, then in that case that can have fairly significant implications for training. But I also know one woman in particular who's incredibly fit, can do chin-ups and everything, and doesn't really have much of a lat. So I mean, the body compensates well, but yeah, just knowing like, is this a muscle that's now gone? How does that modify your training is obviously very important.
Yeah. So with the lat, and then also the one that can be taken from like your like abdominal muscles, your transverse abdominis. So a lot of women there is like a reduced like muscular strength there, but there is kind of a third kind of a flat that you can get, like called the dip flat, which doesn't actually involve the muscle, so that can be kind of implanted into the breast, and you don't see that reduction in strength with it either, which is good. But a lot of women kind of will, me and Patty were talking about it before before we started, there will be kind of a reduction in strength, but kind of with strength training, that can be, like you're saying, the body can compensate, and they will kind of regain that strength typically kind of 6-12 months after.
100%. So look, we're not going to go into all the nuances of mastectomy. There's a variety of reasons why someone will get a mastectomy. That's not for us, but we do have to dive a little bit deeper with it to actually understand the implications for training. But before we do that, is there any kind of complications that we should maybe be aware of, because that obviously would inform our approach to training then afterwards?
Yeah, so big ones, that's the same for any kind of surgery, and the breast augmentation is like like a wound infection, pain, particularly kind of chest wall pain. Women that have had mastectomies as well, they might have like phantom breast pain as well. And there's also can be a lot of like arm morbidity as well, which we'll go into. So kind of reduced kind of shoulder function, range of motion, and there can be some nerve damage as well.
100%. Now, before we get into the training, we have to also kind of just identify, well, it does actually matter in the grand scheme of things, and we talked about this a little bit before the podcast as well, Nicola, in terms of like, why are we getting the mastectomy? That's going to potentially influence what we do after that, how we think about training, but it also influences, or it should at least influence, your discussion with the doctor. For example, if you're getting a mastectomy for cancer, for example, that's going to be very different than if you're getting a mastectomy because you are a trans individual who's going from female to male. Like what you want from that surgery and what you want after that surgery are going to be completely different things. For example, if you are trans female to male, you might want to have really well functioning pecs after that. You might want really like something completely different than I don't know, someone that's 45, 50, and they're just like, oh, I found a lump and now I have breast cancer. Like if you're going to be I don't know, a 21-year-old and you're going female to male, you might be like, right, well, I actually want to be able to build up my pecs. I want to be able to have this kind of like outward masculine appearance. So that's going to change things. That's going to be something that we need to consider, and that is going to be something that you need to talk to your doctor and your surgeon obviously about, because it does change how we go about things. Now, that is a little bit beyond the scope of the stuff that we're talking about, but I want people to be aware that you kind of need to think about that stuff, not ahead of time, like obviously ahead of time, but if your doctor says to you like, oh, you have to get a mastectomy because you have breast cancer, it's not like you're going to be like, well, hold on a second, I just need to think about everything here. You're kind of going, okay, well, I'm going to follow your guidelines, the best practices that you're clearly telling me to do, but there are some other reasons someone would get a mastectomy. It's not just like, oh, there's this blanket reason, this is the whatever, do either of you have anything to say on that?
I don't think that. No, yeah, just you were either in terms of this, getting it because like there is cancer in the breast, or risk reduction. It's the main.
100%. So how does this change our approach to training?
Yeah, so with this, I think previously a lot of the mastectomies, kind of radical mastectomies, they did involve kind of removing the pec major, but now they do more kind of a modified mastectomy, which preserves the pec major. I think it just removes some of the overlying fascia. But what a lot of women will find post mastectomy is kind of, you know, an impaired kind of shoulder function, like particularly kind of flexion, abduction, and this seems to be more pronounced in women if they've had the mastectomy on their kind of dominant side. So if you're right-sided dominant, not a right-sided mastectomy, there seems to be kind of reduced kind of range and strength kind of on that side. But again, when they found that when they did strength training, that imbalance kind of evened up, which is positive, which is good. And then radiation. So some women who've had a mastectomy will get radiation to the area afterwards, and again that just kind of further reduces the risk of recurrence. Not everyone will get it. Again, that'll just be down to your doctor. But again, there might be a slightly reduced range, and that's due to kind of fibrosis from the radiation. And again, you know, like we were talking about with the breast augmentation, kind of you know, kind of a new posture, there might be kind of a lot of pain that you're just kind of, you know, keeping yourself in kind of one position for an extended kind of period of time, you know, based on kind of whatever feels comfortable for your body. So there's kind of, I suppose, a lot going on, you know, in terms of that.
Yeah, and again, as we said, like it really does depend on why this happened, what's going on after that. Like you said, is there radiation? Maybe we're also on some chemotherapeutics. Like there's so many different things to just keep track of that it can be very well, hard for the individual. Obviously, if you're getting your breast removed, there's psychological stuff as well with that. Like there's so much going on. But like you said, if we're just talking about the stuff that, you know, we have a little bit more say in, it does seem to be the fact that, or does seem to be the case at least, that, you know, doing some sort of training, once we're able to, you can, you know, ameliorate some of these strength deficits. You can kind of get to a position where you're like, okay, I'm back to close to the function that I wanted to be at, or that I previously was at. And like Gary said, that this is the case even if you're getting like some of your muscles like chopped off basically, you know, and placed elsewhere. Like you can still, like the body is very adaptive, you know, you can still get back to doing exercises that you enjoy. You can still get back to, you know, movements that you enjoy. Like, yeah, there might be changes in function. Yeah, there might be changes in like your overall ability, or your overall ability to like fully progress. You know, like you might be able to, like your quote unquote true genetic potential was to be able to do 100 kilo chin-ups, and then you've got like your lat chopped off or whatever. It's like, okay, now you can only ever get up to like 80 kilos or whatever. But it's, you know, I would argue that it's the journey, not the destination. But that's all stuff that we have to take into account when we're going, okay, well, how does our training, how do we modify our training? And a lot of the stuff that we talked about in regards to, like, you know, breast augmentation, it does apply here in terms of the recovery. Now, the recovery, again, it depends on why you had the mastectomy. It depends on what exactly the mastectomy surgery involved and what was going on, maybe again afterwards as well, like was there radiation, chemotherapy, like it depends on all that stuff. So the timeline is going to be different, but the thought process stays the same in terms of how we approach it. You know, it's like, okay, you're going to be off for, let's just say for you as an individual, you had a mastectomy, you know, it's 3 months, and then you're able to slowly start getting back into things, you know. We're still going to be thinking, okay, like Gary said, that kind of rule of thumb, we're going to use the next 3 months to slowly start, you know, ramping things back up. We're going to do the exact same thing we did with the breast augmentation and go, okay, well, what ranges of motion do I have? What exercises? I'm paying attention to this stuff. How does this feel? How does this modified? Like all of that stuff, you pay attention to it, you keep a note of it, and then you effectively track it over time and see, oh, are these things improving? Am I able to get back to the exercises that I enjoy? Am I able to, you know, do X, Y, and Z? Oh, I'm not able to do that, but I still want to train these muscles or do whatever. How can I modify these exercises or this exercise selection so that I can still train these muscles, you know? So it's kind of the exact same, even though these are two completely different like surgeries. Anyway, do either of you have anything else to say on that? Because we literally could do a deep dive on this, but what are your thoughts?
Yeah, no, literally, I suppose just to point that with the strength and balance, obviously with the upper body, once you can return to kind of you know, full training, I suppose looking at kind of unilateral work, and particularly if you've had one of the, like your lat chopped out, if you've had the lat flap done, just unilateral work might be more important then.
Gary, any thoughts? You've been very
Sure,
quiet.
I'm not sure there's too much really to add. I think just that point that, the body is incredibly competent at compensating is just really important. And I think almost every muscle in the body has some sort of means of redundancy, or abundance, I should say, that there's another muscle or multiple other muscles that can take over its job. If you've had your lat removed, it's like, all right, no problem. The shoulder extensor function can still be taken care of by the teres, the posterior delts, long-handed triceps. There's still plenty that can keep that function going. And I suppose that's just something that the one area where there won't be compensation or, an equal presentation is going to be in the aesthetic side of things long term. So obviously that can be difficult if maybe your physique was really important to you and you were into developing a symmetrical physique. Obviously you're not going to have a symmetrical appearance in your back if you've had your lat or if you've had a lat procedure. So that's just something that you will get used to over time. And I think a lot of people, once they have restored their function and they're able to show that, hey, look, I'm strong despite this, I don't think the aesthetic side of things will hold you back too much, really, unless you're competing, obviously. But the function side of things, you'll be fine long term.
100%. Anyway, I've nothing really else to add to this. So you want to wrap it up, Gary, or unless Nicola, you have anything else to note?
No, all good.
Perfect. I think in summary, before you have any surgical procedure, you should try to understand the pros and cons. In some cases, obviously, mastectomy for breast cancer surgery, it's a lot more necessary. So you might just have to accept more of those risks. If it's something like a cosmetic procedure, then maybe you accept less risks. That's totally up to you and your risk matrix, but you should understand the complications. You should understand what's potentially coming your way, both short and long term. That will help you make an informed decision. Once you've had your procedure, regardless of which it is, understand that there's a healing period afterwards. And what's going to serve you best long term is to facilitate that short term healing. So particularly relevant for our audience of, fit fam nutters who want to get back to the gym ASAP. Just take your time. Okay. It'll serve you much better long term. Don't be trying to, expedite the process and get in, to the gym with, you still have a scar that's quite fresh. Like, it's just not wise to do that type of thing. Some people do, but it's not wise. So take your time. That will serve you long term. And then once you do get back to the gym, just treat it like, any other injury. Appreciate, yes, there are some movements that are very likely to be uncomfortable and very likely to be inappropriate to reintroduce, but gradually reintroduce over time. See what's comfortable. Start at maybe 30 to 50% of your previous training program and build up over the course of, at least 6 weeks, potentially longer. After mastectomy, if you've had, as we said, radiation, maybe there's chemotherapy or other medications involved, there might be additional modifications to that timeline, depending on how well you are. But just take your time and you'll be fine. So with all that said, breast surgeries are not. We do have coaching spaces available. So if you're interested in the coaching process, then we'd be happy to take you on. We have a lot of different coaches on the team now, all of whom are incredibly competent. Very proud of that. And if you'd like to apply for a spot, you can do so in the description box below or by contacting any of us on social media. We do also have a lot of content that we put out for free, so make sure you're following along. Follow along on Instagram, you'll find everything else. Also subscribe to the newsletter. It goes out weekly. It's content that doesn't go on our social media, and I like to think that it's quite valuable. So subscribe to that, again, in the description box below. Other than that, we have, our little education portal still tipping away to be evolving very soon. That's the Coach's Corner. If you'd like to subscribe, you can do so, and it will afford you some advantages in future in terms of other services that we'll be offering, and I won't say any more than that. Other than that, I think that's everything. If you'd like to leave a review on the podcast or share it with friends, family, acquaintances, enemies, we really would appreciate that. Your enemies are our enemies, so make sure they at least get good information. Now, I think that's everything. Anyone else have anything else to add before we say goodbye?
No, I have nothing.
Very good. Thank you very much, guys, for listening. See you soon.